short breath. Similar process with systolic heart failure. So that was diastolic, where you cannot relax. Systolic is where you can relax, but you really can't squeeze.
Mm-hmm.
So that's more common with coronary arteries. With other things like cocaine use and alcohol, that's not doesn't really apply to you. For you, if you had coronary vessel bypass, that's most likely what it is. So typically, you're not squeezing as well. What is normally a squeeze is that you get 100%, 60% comes out. Every time, every beat, 60% comes out of the heart. We start calling it congestive heart failure when it's less than 50, less than 40, that kind of stuff. Depending on how low that is, how less you're putting out, that's going to be the severity of your congestive heart failure. Okay?
Yeah.
So same thing, because of you're not able to pump as well, the fluid builds up into the lung, causing the dyspnea into the rest of the body, causing the swelling in the stomach and lower extremity and that kind of stuff. Typically, it's in the lower extremity. Yours is a little, well, we'll see. We may need to do more further testing to make sure there's not something else causing that fluid buildup in the stomach as well, in addition to congestive heart failure. So that's where we're at right now. Like I said, Lasix, diuretics to get the fluid off, and then we put you on medication that's supposed to help with strengthening the heart. So that's going to be beta blockers, ACE inhibitors, depending on other medication as well as cholesterol medication. You're already on beta blocker, atenolol, as I understand.
Right.
I'm going to change that to some of the newer ones, not newer ones, like something like metoprolol, because or Coreg, those are the better medication for the heart, more studied for the heart failure. And then I'm going to start you on a low dose of lisinopril for that as well. And we'll see where the plan is going to be getting an echocardiogram, getting cardiology to kind of take a look at you and optimize your blood pressure, optimize your congestive heart failure medication.
Okay.
That's assuming it's congestive heart failure. It could be something else. So, but from your history and the fact that you've been getting up in the middle of the night with shortness of breath and that kind of stuff, it's swelling, quickly, that kind of stuff is more consistent with that. You've been noticing getting more fatigued when you're walking, that kind of stuff. Okay, less. You're not able to do as
yesterday
much.
was the first time he rode in a handicap store ever. You couldn't get him to get in one, and so he did it on his own. He just knew he couldn't go any further.
Any other? No chest pain?
No.
Okay, good. No, no. And cough? You've been having some cough or no?
A little bit.
For the last few days?
Yeah.
When that started? Yeah. That's also because your pulmonary lung is actually a little irritated because of the fluid, probably. So that's what. But no fever, no chills, none of that stuff. So unlike you. Mind if I just listen to you real quick and go from there? Okay, if you could lean forward, just listen to that. You're breathing it out.
He's so red. And that's kind of like just started today, the redness.
And this morning.
Feeling pretty anxious or anything like that?
No, I reckon. Just the
It's swelling in that part.
nasal stoppage, all that kind of stuff.
So colon stuff.
Yeah, I can't, my head can't get down. If it gets down, it's bad shape.
Yeah, that, it could just be from that, so keep an eye out on that. But as soon as we get more fluids off and whatnot, I think you'll be feeling better.
Okay.
From what I understand, you already feel better, right?
Yeah.
So that's,
A lot of fluid came off.
yeah, that's basically all the extra fluid that was, like I was saying, couldn't get it out, so it's backing up.
Yeah.
So it's going to be better.
When I started talking like a normal man,
Mhm.
I started feeling better.
Okay.
Because my brain was so confused.
I see. Were you having stopping in the middle of the sentence to talk and not because of shortness of breath?
Yeah, it very bad. And he was talking about his father that's already been gone for 2 years and
Nice.
crazy stories and
Yeah, so it could have been just because of the fact that he wasn't getting enough oxygenation and that kind of stuff. I'm glad you're doing better. So
Yeah, thank you.
Any other question or anything else I can answer for you guys?
Okay.
when will he go to a room? Do they know yet?
That I don't know. I can't tell.
That's not your job, huh?
No,
I mean,
not my job, ma'am.
The order's been put in, but that's going to be depending on whether there's a room available, is it clean, is they have nursing staff, and that's not, but we'll see. Okay?
Okay.
All right, take
Thank
care.
you,
Thank
doctor.
You tell them to bring me something to eat?
That's fine, yeah. We'll let them.
He will do that.
That's fine.
They dropped
Take
it?
care.
I did. Well, he had me drop